We're now in day 2 of National Immunization Week, and doctors across the country, including here in Manitoba, are urging folks to consider getting up to date with their shots. Dr. Bunmi Fatoye is with the Winnipeg Regional Health Authority. She's a medical officer of health and joins us by Zoom. Welcome to the program.
I'm glad to be here. Thank you.
Dr. Fatoye, Immunize Canada on its website asks people not to, quote, turn the clock back to former times. How much does that resonate with you?
Oh, it resonates with me a lot because, there was a time about even just a few years ago, 5 years ago, when we wouldn't hear about some of the vaccine preventable diseases. And now we're hearing about them more and more. And in this particular time, we're hearing about measles, when there was a time when we had in the whole of Canada maybe under 300 cases in a whole year average. And now we're seeing, lots of cases. So it resonates with me.
Right. And when you look at Ontario, up to 925 total cases as of last week, and not long ago, some new warnings in Edmonton, in Alberta. I know we've heard about those warnings of potential exposures here in Manitoba. What worries you the most as you continue to hear about these new cases?
What worries me the most is that we have vulnerable populations out there who, either because of age or because of immune compromised condition, they are not able to get immunized. So this population will be at risk. And we know that some of these diseases can be quite deadly. They can have significant complications. They can have long-term disability, and of course, death in some situations. So, it worries me that we have that population out there who will be at risk of contracting the disease, and we have an opportunity to do something, which is to reduce that risk for this population.
What do we know so far about Winnipeg or here in Manitoba? What are the numbers so far?
In terms of immunization,
in terms of infections, I know it's something that we've heard about when it comes to specifically measles.
Yeah, so in Manitoba, in this last quarter, we've had a total of 10 cases in total. And the 10 cases definitely were due to exposures outside of Manitoba. So that's very important to note. And luckily enough, we haven't had any subsequent cases from that exposure. And so we really want people to be aware of their immunization records. So they should make sure they're up to date. And if they're not, they should catch up with the required immunizations.
Dr. Fatoye, getting vaccines and folks being worried about getting vaccines aren't new. What do you think public health officials have learned from COVID-19, the pandemic, that can help adjust how to convince people or how to provide that message so that it's well received and people can feel like they're making an informed decision?
Yeah, it's been shown over and over in literature that the primary care health provider is a trusted source of information. And I think that would really help with the level and the amount of misinformation that is out there in the public. So I would encourage everyone to have that conversation with your healthcare provider about the importance of vaccines, what vaccines are required for you to make sure you have and you're up to date with, and also have the opportunity to talk about some of the, the myths that are out there that, sometimes have prevented people from getting out there and getting immunized. So I think talking to your primary healthcare provider will really be helpful. And we saw that we had trusted healthcare providers on television, on radio throughout the COVID pandemic season, and that really helped as well.
And I mean, you are one of the folks who have taken this front-facing role. What are you hearing from people as you continue giving this message? Are you getting a sense that they are listening, or that they're understanding what you're saying and then making a decision towards getting immunized?
You know what? I think people are understanding. I think people are listening. But I think there's that extra step that people have to take, which is to talk to somebody who understands their medical history. And I think that is what I'm trying to get out there, that, yes, I'm saying it, and I am advocating that people have that conversation with their healthcare provider so that they can have that full discussion that involves not just them as an individual, but it also involves their family, because immunization is not just about one person, it's about protecting the community as well. So that's, I think people are listening, and they would take that action.
What's at stake here, do you think?
Yeah, well, what's at stake? We would have a case of measles, and we could have somebody die of measles, which is totally preventable. And I think that we don't want history to repeat itself.
Have you thought about what you'd consider success? Because it sounds like the learning from COVID-19 and past pandemics is there has to be a trusted person or a trusted medical professional that folks speak with. And it sounds like people are doing that. Is that as far as you would consider success, or what would you consider success?
Success, in my own thinking, is that we don't see the level of disease that we don't see the level or number of diseases increasing in our community. And we know that there are lots of variables and factors that are at play when we talk about the control of disease. Vaccine preventable diseases remain a threat in our society. And there's so many factors, such as, traveling, that also have to be factored in. So I think the more people who get immunized, so not just the numbers, but it's important to make sure that our numbers, our coverage rates remain high. That would be success, because we can't, achieve 100% coverage. I am very aware of that. But we want it high. We don't want the coverage rates to drop, and we want people to be aware of the fact that the diseases are there. So success, in my own, the way I look at it, is that the coverage rates are high and people are aware. They're talking about it. They're talking about it. They're having those conversations, and people are informed.
Are you able to say whether or not I mean, we're in day 2 here. What's the news headline here? Are people listening? Are you seeing increased vaccination rates and uptake?
Well, I think what I've seen in my day-to-day job are people have been paying attention to the news, particularly around measles, and they have also been aware of the signs and symptoms of the disease. And there's been more reporting of suspected cases of measles. They haven't been true cases. So this presentation is leading people to their healthcare provider. So that creates an opportunity to have the conversation and also catch up on any outstanding immunizations.
Dr. Bunmi Fatoye, thank you for the time today, and take care.
Thank you.